pollutions and excessive use of mobile phones are damaging the internal parts of ears, due to which people are losing their hearing capacity. Nowadays, a large number of hearing aids devices are available in the market, but all are not of good quality. Many health problems are arising due to use of such unhealthy, cheaper hearing devices. Keeping in view the safety of people's health, Starkey India has launched a new device which is affordable, safe and comfortable to use. A very big advantage of this device is that it can also indicate the complication, if any, like heart, pulse rate, etc. Dave Fabry, Starkey, Akhil Chauhan, Managing Director Starkey, talking to Janmanas Vivechana, the opinion about hearing aids worldwide.
So that also is a different. No.
Because they speak at a 65 dB level because of noisy conditions.
Because of
noise.
because of and it's true because.
I hope you are not asking me to.
No, because we tend to speak little louder in India, and because of that, a lot of times the kind of loss which I treat in US on a regular basis, which is 40% of my patient, which is mild to moderate, in India they are like, thoda ucha sunta hu, that's the usual thing. But you have to understand, hearing loss is almost like pregnancy. And you cannot be little pregnant or more pregnant. Either you are pregnant or not pregnant.
It's whether you're a candidate for benefit, and there have been only in the last 20 years, there's a national health database in the US called NHANES, capital NHANES. And in that NHANES database, they're doing all kinds of things about a 5-year interval where they'll take blood tests, they'll take questionnaire data, they'll do a hearing test, and that's really only been since the mid-1990s that they've done hearing screening among a population that is representative of the overall population and correlated that, importantly, to other health conditions. And so number one, really since the mid-90s we've been able to see by age what's the prevalence of hearing loss. And then you raise another very important issue, and that is hearing loss is not a condition that occurs in isolation, particularly as we age. Hearing loss is often accompanied by increased comorbidity with cardiovascular disease, by cognitive decline. We're seeing increasingly an emphasis on untreated hearing loss. Only about a decade ago was it linked that people who had hearing loss that they didn't do something in the form of hearing aids or use of some sort of prosthetic, that if they didn't, that they had greater cognitive deficit than the same population without hearing loss or that did wear amplification. We're currently waiting the results of global studies that are looking to see if this is not only a correlation, but actually causative. That the longer you wait, if you have a hearing loss, there are increasing studies investigating whether that period of time that people delay the decision to wear amplification is accompanied by increased cognitive deficit, which is very significant if those data show. Right now we know there's a correlation, but we don't know that we can say causation. But there are studies that have come out of Lancet in the UK where they've looked at modifiable risk factors, midlife, for cognitive decline, and of those modifiable risk factors that Lancet published in 2020, hearing loss in midlife was the biggest single modifiable risk factor related to cognitive deficit.
What is the demand in market of hearing aids?
The demand in market In what perspective? 466 million people with hearing loss, 19 million hearing aids sold globally. So there's a big gap between the need and the use, and it's because of accessibility, affordability, and as we've been discussing, stigma. And then we also want to increasingly look at hearing loss and the overall connection to overall health and wellness, including both cardiovascular, cognitive, risk of falls. There's a whole host of comorbidities, and that we think that reducing the stigma will help raise the demand, because people want to be better connected to overall health and wellness, as well as better connected to each other by providing better hearing.
What is the difference between your hearing aids and market hearing aids?
Certainly the first goal of every hearing aid is to compensate for the specific hearing loss suffered by an individual. So when the most important thing is that someone goes and gets an assessment of their hearing. This is often called an audiogram. And every hearing aid is built to compensate specifically for the hearing loss that an individual end user has. Every hearing aid also needs to try to perform as well in quiet and noisy listening environments as possible. So most hearing aids now are digital, and they use microphones that can improve speech understanding both in quiet and in noise. Our hearing aids specifically enable a connection to Android and iPhones, a direct connection. And in this case, when you say what our hearing aids do that is different, is not only providing the amplification appropriate for a person's hearing loss, we can actually track how much physical activity a person has throughout the day, how many steps they're taking, not unlike what you'd have on a wrist. We can track whether or not they're engaging with other individuals, not measuring what they're saying, but we're trying to connect to that overall health and wellness. And importantly, we have other use of artificial intelligence. We were just discussing this with our team here, that hearing aids are built to all hearing aids today are built so that they automatically adapt as the person's wearing the hearing aids and going throughout their normal day. We have a feature that enables the automatic artificial intelligence to interact with the individual, to use a feature we call edge mode, to have them be able to tap on the device, press a button in the app to do an acoustic snapshot to optimize speech audibility for any listening environment that they're in. There's no other hearing aid on the market that has this feature that combines artificial intelligence with listener intent to optimize speech audibility regardless of where they are.
As you know that hearing aids are very hazardous for health. And what are you doing in your hearing aids for safety of health?
For the health piece, well, I mentioned that we can track physical activity, we can track social engagement, and enable a person to monitor that in the user app if they're connected to a smartphone. We can also do fall detection. If a person is wearing their hearing aids, if a person has a hearing loss, they're 3 times more likely to suffer falls than someone without a hearing loss. And this fall detection feature that we're, again, the only manufacturer in the market to have a feature that if I'm wearing my hearing aids and I unfortunately suffer a fall, I can select 3 contacts to receive a text alert that tells that I had a fall in real time, shows them on their smartphone, and actually shows on a map where I was if I fell, if I was unable to respond to them. We think that's an important connection to overall health and wellness, beyond that fundamental goal of speech intelligibility, sound quality, and using that edge mode feature. And we think that connects to overall health and wellness. We also have a feature that enables a person to use a digital voice assistant, if you will, by tapping on the device and then saying and asking a question, and it'll enable them to hear an answer in their ear.
As an expert, how much time?
I think
All American markets, we do see in Asia, what's the adoption rate of hearing aids
Here?
in India?
India 2%, less than 2%.
2%.
Less than
So in North America, that adoption rate is currently around 34%, so a third. In some European countries, and that's because in North American markets, most of the time, it's paid at least in part, if not in total, out of pocket by the end user.
Okay.
What we're seeing in some European countries is there is a social benefit provided by the tax structure. Denmark, Sweden, UK,
Do insurance firms?
where they have, it forms the
हमारे यहाँ तो नहीं है
basis.
ना?
in India,
India doesn't
it's
cover.
not, they don't cover hearing aid in the insurance.
But here's the important point that goes back to my initial statement about stigma.
Hmm.
So US, I said, 34% adoption, it's primarily a private pay system. India, 2%, primarily a private pay system. Denmark, which has a fully subsidized market where the taxes, your taxes are paying for hearing aids, so that if you have a hearing loss and you want to get hearing aids, it doesn't cost you anything out of pocket.
Mhm.
What percentage of people use hearing aids in Denmark? What, you want to guess?
Come again, please.
So if I live in Denmark and hearing aids are provided at no cost to me, I can get them for free because I've already paid for them in my tax system. What percentage, going to your, I'm asking not a rhetorical question, what percentage, 80, 90? Still only about half. So that gets to my earlier comment that stigma remains the most significant barrier, because if we give them away and only half of the people use them.
Second part of my question was how big is the global market for hearing aids? If you could just quantify the number.
Yeah, 19 million were sold in last year.
Translating into
Percentage?
dollars.
Oh, dollars.
Oh, that will be a tough question because different
Yeah.
currency.
There has to be some research agency doing which may have done something on this.
We basically, when we talked about the quantum units because the costing in different countries.
सर वो हर प्रोडक्ट में अलग अलग होता है, हर प्रोडक्ट का अलग कैटेगरीज होता है, लेकिन एक एस्टिमेट बनता है उसका.
So he will work it out, but we don't want to be like units. We know what revenue it is generating globally. I gave you the Indian concept like around 465
yes.
crores. Global, how big is it? If Dr. Fair is able to
इंडिया में CAGR कितना रहा है यहाँ पे?
6.5%.
कितने साल का है ये?
5 साल.
You know, it's 5 players. It's non-adoption. The biggest competitor that we have is people being resistant because of stigma or some other factor. So that's a collective burden that we bear, is to say, how is it that we can get more people to shorten, as Sugata said, the 4 to 6 year time period from when someone is told, I think you should get your hearing tested.
So this is
to
ENT
get hearing
specialists
aids.
who will prescribe.
No.
It's going to vary by country, and so in looking at it from a global overall perspective, we don't, as a privately held company, we don't typically report our, we're not required to report our finances
No, I'm just asking.
per se, but
Are you
but,
among
yeah.
one of the major companies or not? That's what I.
Oh gosh, yes. There are just a handful of companies. We're the only U.S.-based global manufacturer of hearing instruments. In the U.S., we're the largest of the custom style of the devices. We make more of those globally than any other manufacturer does. And then everyone else is in the mix for, you know, one style or one type more than the other. But we're the only U.S.-based, we're privately held. We have been so since 1967 when we were formed. We've been in this industry and we're in over 100 countries where we're doing business. So yeah. I would say we are definitely a major manufacturer and a global player.
How do you see India as your
Target.
Well, I mean, 1.2 billion reasons to see India as a very important target of ours, and a growing market, and one where there is much opportunity.
You have a manufacturing.
We call it customization units. Manufacturing all happens in US rather in Mexico, and some part of the products are being manufactured in US. R&D is in US and Israel. We have an R&D unit in India also who works
Where is
on
it?
the R&D unit, research and
Where is it?
here,
Right
in
here,
this office.
right here, in this
downstairs,
office,
where you
yeah.
were having tea. Downstairs, the opposite unit is today they are working from home. We do R&D on the connectivity of Android phones because India is a larger user of Android phones. So we are bringing technology which is available now in our hearing aids. You need not to pick a phone to make a call. You can directly stream any call to your hearing aid through a phone. Directly the stream. So they are doing R&D here.
So primarily you catering to
All
metro.
No, we are, Starkey is here for the last 15 years.
Yeah.
And we are catering all the segment. This is a new product line we are bringing in up, which is more of artificial intelligence and edge mode, what previously Dr. Dev have spoken about. That is speech audibility, what we call about.
Yeah, that's the number one job of
Yeah,
it.
that I
Speech
heard
audibility.
read about it. That
Yes, so
Starkey
if
is
there is a
super-
noise and in noisy situations, our product gives you a better speech and understanding and also captures the surroundings, what kind of surrounding, what kind of noise is there, what kind of changes that artificial intelligence has to bring in so that you hear a better speech. So that kind of technology with a single tap or just do you can.
So how many products you have in Indian market?
The kind of range, if I talk about there are form factors. Right now we are running 7 line of products in the market. The 7 line of products are there. Then the form factors are different. Like these are the these called IICs, invisible in the canal. These are ITCs, that is in the canal. Then we have RICs and BTEs.
So these are the different form factors, ones that fit over the ear, ones that fit
Inside
invisibly in the ear, ones that fit, slightly more peripheral, like these, and importantly, each of these, all of these, and everything except for this tiny one that's entirely in the canal, can be directly connected to a smartphone, so that any audio coming out of the smartphone at all, importantly the phone call, but podcasts, any audio coming out of a phone can stream discreetly and directly to the ear. And we use that in combination, not only for audio coming out, but we can do it for transcription and translation. So we're really looking at envisioning transitioning the hearing aid, importantly, from that single function of providing better speech understanding and quiet in a noise into multi-purpose, multifunction, connecting to that overall health and wellness. We've been the first hearing aid company, to your question, in 2018 we were the very first hearing aid company to embed sensors in the hearing aids directly that are capable of measuring movement. Why is that important? We talked about the health and wellness piece, the connection to overall health and wellness. We want people to be more physically active, good for musculoskeletal strength and aging, good for cardiovascular health. We want them to be socially connected, the cognitive issues. And so within our application, the IMU can record the physical activity. We're using the acoustic activity to ensure that when people are wearing their hearing aids, that they're talking to other people, that they're engaging in their real world, they're going out into other environments. We even have that fall detection feature. We were the first and only hearing aid company to incorporate the ability to detect a fall when someone's wearing their hearing aids and contact up to 3 trusted contacts in the unlikely and unfortunate event that they suffer a fall, even show them on a map where they are. So we're really looking at transitioning from single purpose into multi-purpose, multifunction, and helping to reduce that stigma by saying, yeah, you can stream phone calls both ears hands-free. You can track your physical activity as if you would on a wrist. You can even use a digital assistant to query on the internet, who's the most famous cricket player in the world, or to push reminders for medication. One thing we track quite carefully in the United States is we know that adoption of the chronic prescriptive medications in the aging population is only about 50%. We found we can increase that by prompting, using reminders throughout the day to say, take your medication, drink water, something silly, but to think about hydration and medication. And we can prompt that directly to their ear.
How many units can